Hello viewers, good day. I am Novi Shira M. Solomon, a second-year nursing student from LaSalle University Ozamis. Today I will be presenting to you what is a psoriasis, how the disease develop, the types of psoriasis, the signs and symptoms, pathophysiology, risk factors, treatment options, prognosis, and prevention of the disease. If you are new to this channel, please hit like and subscribe. I will begin my discussion by explaining to you what psoriasis is. Psoriasis is an autoimmune disorder that affects the skin, causing the rapid buildup of skin cells. This results in thick, red patches or plaques covered with silvery scales. Psoriasis is a chronic disease with no cure. Now, what is the primary cause that leads to the development of psoriasis? In psoriasis, the life cycle of your skin cells greatly accelerates, leading to a buildup of dead cells on the surface of the epidermis. It is caused by an overactive immune system that attacks normal tissues in the body. As a result, their immune system creates inflammation, which is seen on the surface of the skin as skin plaques. There are different types of psoriasis. This includes plaque psoriasis, the most common type of psoriasis, which causes dry, itchy, raised skin patches covered with scales. Next is gutted psoriasis, which is usually triggered by a bacterial infection. Next is inverse psoriasis, which mainly affects the skin folds of the groin, buttocks and breasts. There is also nail psoriasis, which affect fingernails and toenails, causing pitting, abnormal nail growth and discoloration. Next is pustular psoriasis, a rare type of psoriasis which causes clearly defined pus-filled blisters. Lastly, the least common type of psoriasis, which is called erythrodermic psoriasis. It can cover the entire body with a peeling rash that can itch or burn intensely. The most common signs and symptoms of psoriasis are itchy skin, dry, cracked skin that may bleed, nails that are pitted or cracked, and joint pain. Let's move forward on the pathophysiology of psoriasis. It begins with the trigger factors of psoriasis, which could be due to stress, genetic, or an autoimmune reaction. This causes hyperactivity of T cell. These T cells releases cytokines, which contributes to the inflammation and rapid proliferation of skin cells. By that, it does not allow the cells to manufacture a keratin. As we all know, keratin plays an important role in the health and function of the skin. Keratin provides structural support by forming a protective barrier that protects skin from physical and environmental damage. Now, an epidermal hyperplasia and improper cell maturation can occur. As a result, immature skin cells do not have enough time to mature properly. This then leads to an accumulation of thickened, scaly patches on the skin's surface, which is seen as silver scaling of skin or the scaling presentation of psoriasis lesion. The risk factors of psoriasis are family history of the disease. Having a family history of psoriasis increases the likelihood of inheriting these genetic factors associated with the condition. Next is a problem with the immune system, since psoriasis is an autoimmune disease, meaning the immune system mistakenly attacks healthy cells and tissues in the body. Third is skin infections or injury of the skin, particularly bacterial or fungal infection, since it can lead to an inflammatory response in the skin. This inflammatory response can activate the immune system and trigger or worsen psoriasis symptoms. And lastly is the rapid withdrawal of oral or injected corticosteroids. When corticosteroids are rapidly withdrawn, the sudden loss of their skin thinning effect can result in increased friction, irritation, or trauma to the skin, which may induce or worsen psoriasis symptoms. As for the treatment options for psoriasis, it includes topical therapy, light therapy, and oral or injected medications. Topical therapy or medications are treatments that are applied directly to the skin to treat various skin conditions. This includes corticosteroids, emollient creams, and vitamin D analogs. Second is the light therapy, also known as phototherapy, which is done by exposing the skin to specific wavelengths of ultraviolet light to reduce inflammation, slow down the overgrowth of skin cells, and improve the symptoms of psoriasis. An example of light therapy for psoriasis is the Psoralen plus ultraviolet A or the PUVA treatment. Lastly is the oral or injected medications, which are the two common routes of drug administration used to deliver medications to the body. This includes steroids and methotrexate. Let's now talk about the prognosis of psoriasis. Psoriasis is a lifelong disease that involves periods of remission and flare-ups. The severity of the disease may depend on factors such as coexisting diseases and the type of psoriasis one has. The doctor will find a treatment that works for the patient. Here are the preventions for psoriasis. First is to practice stress management techniques. Activities such as deep breathing, meditation, and getting enough quality sleep is crucial for stress management. Follow a balanced diet and engage in regular physical activity to support immune function. A balanced diet that includes a variety of nutrient-rich foods provides essential vitamins, minerals, and antioxidants necessary for optimal immune function. Next is to apply moisturizer regularly to keep the skin hydrated, minimizes dryness and itching. By keeping the skin adequately hydrated, moisturizers help reduce dryness and improve the skin's overall condition. Complete course of treatment exactly as prescribed by the physician. Completing the prescribed treatment course helps ensure that inflammation is adequately controlled, reducing the frequency and severity of psoriasis flare-ups. Lastly would be regular medical checkups to monitor condition, treatment effectiveness and address any new concerns. Regular checkups with a dermatologist or healthcare provider allow for systematic monitoring of the disease's progression. These appointments help assess the severity of psoriasis, track any changes in symptoms or affected areas, and determine the overall impact on the individual's health and quality of life. That ends my presentation about psoriasis. Thank you viewers for watching. Let's fight against skin flare-ups. Don't forget to like and subscribe to this channel.